And to help us out as we decipher this, Doc Talk is our friend, Reader's Digest Editor-in-Chief, Liz Vaccarello. Welcome back, Liz.
We have a story in Reader's Digest. We're always trying to simplify people's lives. And you'd think that these acronyms that you folks use and the abbreviations would make things easier. But you have a lot of lingo. There's over 30,000 abbreviations for diseases and diagnosis and drugs. And it's utterly confusing and dangerous sometimes, right?
It is dangerous because what you think we may be saying, we may mean something entirely different.
How about this one? If I hear a doctor say PE, I think physical education, right?
Class.
Yeah, is that what you
Pulmonary
mean?
embolism.
No.
Right, exactly. Well, that's where it can mean a lot of things. Some people will think of PE and think prep and enema. In another specialty,
That's an important one to distinguish.
Exactly, instead of physical exam. So that's where you see it can get confusing, but it does make our lives a lot easier.
That could happen, I guess. I'm here for my PE, my physical exam.
I'm getting ready to do a push-up,
and you're... Instead, you get you're prepping your enema, and you're like...
All right, how about this one? How about UFO?
It's not an unidentified flying object.
Yeah.
It's an unidentified foreign object. Or foreign body.
Yeah, foreign body.
FB.
Kids tend to create a lot of UFOs because they're swallowing stuff, putting stuff in their nose. Marbles in the nose, toys in the ears, little doll shoes in the ears is probably one of the big ones. Usually you don't need to worry much. If it's in the nose, if you can gently get it out, fine. So I have special tools in my office to get stuff out. But usually if it's a swallowed object, it's pretty surprising how many things can pass through. As long as it's not sharp or toxic, you usually don't need to worry about it at all.
But one thing you do have to worry about, especially for mothers, is an FUO. Have you ever heard of an FUO?
Sounds like a bad word.
It's a fever of undetermined origin or fever of unknown origin. But a lot of times we'll bring patients into the hospital. They'll be there for a week, and we're doing every study we can imaginable to try to figure out what's wrong, why they have a fever, or maybe at home you have a fever that lasts a few weeks. That's a fever of unknown origin. And what we'll do is sometimes we'll get a CT, MRI, PET, computed tomography scan, magnetic resonance imaging, PET scan, positron emission tomography. That's what we do. And the reason we use all these acronyms is for one reason. Number one, I think it makes us feel smart. But it's quick. It's quick. It's so much quicker to say, get a CT scan. Drew, let's get a computed tomography scan. Whew, that's a mouthful. So I think that's the number one reason we use so many acronyms.
It's dizzying. When my dad suffered from cancer, I was living in that alphabet soup of MRI, PET scans, and I found it really helpful to just stop the doctor and say, wait, what does that mean? What does that stand for? And what are you doing? It just sort of calmed everybody down. And they're happy to explain if you stop.
And I'm glad you did that, because I think that if you ever are at the doctor and you don't know what your physician is talking about and they're addressing you, you just need to stop them and say, hey, please explain that. Because sometimes we forget that we've been around these terms our whole lives, but we forget. And another thing people are confused by a lot is they'll be at the hospital and they'll hear, code blue. Code blue is often an adult emergency. But there are other codes that we hear in the intercom.
Code white, pediatric emergency. In our hospitals.
Code red, which is a fire in the hospitals, devastating consequences.
I got the good one. Code brown. That means the patient soiled their bed.
Oh, yeah.
No, code brown.
They
You don't want to hear that.
Usually don't hear that on the loudspeaker.
But we have 100 of these, more of these acronyms in the May issue of Reader's Digest. Some of them can save your life. So it's in the May issue, but everybody in the audience gets a 1-year subscription to Reader's Digest.
Thank you so much, Liz.